Hello, my name is Daniel Rychlik. I'm a reproductive endocrinology and infertility physician. A lot of people have a hard time pronouncing my name, so I always tell people to call me Dr. Dan. I'm basically a physician from OMA Fertility, which is located in Santa Barbara, California. Today, I want to talk a little bit about oocyte preservation or egg freezing for women. This is a very, very interesting topic for me. Not only by the fact that it's wonderful technology for people to embrace and have as an option for them, but also the fact that in my own family I have 4 kids and 3 daughters, and they also embrace this technology. From a standpoint of freezing eggs, or what we call oocytes, this is somewhat of a new technology. And the reason is because there has been some difficulties in freezing eggs in the past. In contrast, we've been freezing sperm for about 30 to 35 years. And the semen, basically, that produces the sperm, has very small cells that survive well with the freeze and thaw process. And this allows gentlemen to preserve their fertility for the future, or in the cases of donor sperm, donated to other couples that would like to use it. The difficulty that people have had with eggs, it's the largest cell in the body, and hence has a large amount of water. And anytime you have water, we all know by putting things in the freezer, they expand. Oftentimes you might recognize this if you put a bottle of water in the freezer and allow it to sit there, it might bust the bottle. And that's the kind of same thing that happens with the eggs. So recently we've developed techniques called vitrification. And what that allows us to do is take the largest cell in the body and freeze it in a very, very easy and effective way. Now, also the important part is the ability to recover that egg to be used in the future. And therefore, not only freezing is important, but the recovery of that frozen specimen is also very important. Now, why would people want to do this? Well, definitely there's a time when somebody is diagnosed with breast cancer or any type of cancer that they have a number of options on their table. One of those is the type of treatment that they're going to have to help cure their cancer. Sometimes those treatments can affect our ability to reproduce effectively in the future. Now, oftentimes the literature in medicine has been very kind of behind the times in understanding what women need in the future to be able to reproduce. And a lot of studies in the beginning of this talked about the ability to recover from chemotherapy or radiation and have normal menstrual cycles. However, as a reproductive endocrinologist and infertility specialist, we understand that just having a period does not guarantee your ability to have a future family. So some of these chemotherapy and radiation therapies can be detrimental. Some of them might not be. And the literature is not really good in understanding what those effects really are in people. To understand why is women are unique in that they're born with all of the eggs they're ever going to have, and they're constantly losing them. What I find interesting is when I talk to people about this, they usually don't see that or understand that or basically know some of this information in the past. Women are born with about 1 to 2 million eggs. By the time they reach the age of 13, they lose about almost 80%, and thus are down to about 200 to 300,000. Yes, you lose most of your eggs before you even ovulate, and therefore there's a very small pool of eggs available. That loss rate of eggs is constant. It continues forever until there's a depletion of eggs or the inability of those eggs to be successful in creating a viable pregnancy. Oftentimes, what we can do is preserve that so that we hold and lock in time those eggs for future use. Now, this is not only available for people that are going through types of treatments for cancer, but also women that would like to preserve for their fertility for the future. Oftentimes, when we see a patient's been diagnosed with some type of cancer, they're purely devastated. They've got a lot of information that they're getting. They're having to make minute-to-minute decisions, and everybody's moving very quickly to get them to treatment. I always like to say it's important for us to pause for a moment and not only talk about what is in front of us about treating the cancer, but what life is going to be like afterwards. It's very important for us to understand, and when we care for these patients, to not get so focused on their cancer that we lose sight of all of the other aspects of someone's life. That we want them to be able to survive their cancer and be able to live their life afterwards. Having 3 daughters and having treated a lot of women, family becomes very important. It becomes a point in which a lot of cultures define a lot of what happens in a woman's life. Decisions are made. School is either decided for or not. Jobs are decided for or not. And there's a lot of decisions based upon that. Our ability to take eggs out of a woman's body and freeze them offers them options. It offers them hope. One of the most fulfilling things that I see is when I get a patient that has been diagnosed with cancer. Everybody is talking to them about all types of things about their cancer, how we're going to treat, what's going to happen, what kind of effects may happen to you. But nobody really gives an optimistic approach on anything. What we'd like to do is kind of change that narrative. We want to talk about, hey, what are we going to do for your future, your family? How can we put it away for today? And so it's a positive thing in a sea of negativity sometimes. What we're able to do about that, we're talking about something positive. Hey, we can kind of come in and freeze your eggs and allow you to have a family after this is done. Sometimes the chemotherapy or radiation or any other treatments that are given are not going to affect the fertility. Still, having those eggs frozen gives people hope to be able to use them if they do need them. I often had a patient that came into our office and she said, you know, the thing that made me get through my treatments was the fact knowing that I had my family frozen in a canister waiting for me to do my job so that we could have a family in the future. And that type of hope is really important. So it's not only a wonderful technique for us to use to give women the ability to make choices, but also to give a woman the ability to have hope. I say that for patients that are diagnosed with cancer, but I do say that for any woman that's out there. One of the biggest things that I think that can be fostered for women's live is the ability to have some choices about when you can have a family and not have to have restrictions on when to do it. So how do we accomplish this? Well, first, whenever a woman is diagnosed with any type of cancer and they give us a call, that's an emergency phone call for us. That's not something that's waiting for a consult when we have available time. That's an immediate consult. We want to basically get you in front of us, talk to you about what the options are, and make you understand that there are things that we can do for you. What we first do is we talk to you a little bit about what are you going through, what your future desires might look like, and what options are on the table. Having done this cryopreservation for a number of years and being the head of cryopreservation in a number of different hospitals, I've had the chance to interact with lots of oncologists, lots of radiation therapists, lots of doctors that deal with this type of treatments. And we work hand in hand with them to get us the outcomes we're looking for. When a patient comes in, it's usually about a 2-week time period that we stimulate the ovary to get as many eggs as possible. Now, oftentimes a doctor might say, hey, we don't have a lot of time. But over the years, we've been able to work out with doctors to understanding that these weeks may be critical for the patient and have to be considered in their overall treatment care. Once we stimulate them, the eggs are withdrawn from the ovaries in a short surgical procedure, usually about 15 or 20 minutes, and the patient goes on with their treatment or whatever they're going to do, knowing in fact that we have preserved in our lab their ability to have a family for the future. There are various techniques for us to do this, and we work closely with the oncologist to make sure that we're not interfering with anything that goes on with their treatment, but also educate our doctors to understand that this is a vital point in their treatment. And even though it might not be directly related to the cancer that they're trying to treat, it is related to the human being inside. And that's very important. People often ask, what does it cost? Luckily, there are a lot of programs to help people out with this. But at Fertility, we find this very important. Egg freezing is the ability to lock in your future and give you options. When we do egg freezing in the general public, it's about $2,000 to freeze the eggs, and a very small storage fee every year to keep those eggs frozen. I always like to say what it costs you to freeze your eggs and store them is probably what you'd pay for one of a storage locker if you had to put some of your old household items in there. But what we're putting away is not old household items. We're putting away really good eggs. Why? Because the eggs that you put away today are always better than the eggs you'll have tomorrow. That offers us the better chances of having pregnancy and having a genetically normal embryo, and thus a successful pregnancy. Now, there's some other advantages to freezing eggs for someone's future. We all know, or maybe we don't know, that as we get more mature, there's a greater likelihood of having a miscarriage or a baby with a chromosomal problem. So younger eggs are always better than those that are not. That's because the rate of chromosomal abnormalities in the eggs increases as we get farther and farther from our birth date. What kind of advantages we get when we freeze eggs is when we go to use those eggs, we can fertilize them and genetically test the embryos that are created. That offers us a lot of advantages. Somebody that's gone through treatment and survived their treatment doesn't want to have another worry about something else that might happen to the kid or their offspring that they're trying to basically create. What we can do is we can say with really good certainty, this baby is genetically normal. We can also say and look at genes that are specifically in that embryo and see if they exist or not. Often we do this for various types of diseases, but as cancer genes become more identified, it's our ability to look for those cancer genes within the embryo. What we can do is not only provide hope for the future, but maybe be a little bit preventative at the same time. In that sense, it offers us a lot of world of good. And that's something that we'd like to do and propagate for our patients. Again, this is a very short break from somebody's diagnosis and treatment, usually lasting about 2 weeks before we're in and out, done with our treatment, and giving that patient hope for the future. We think this is extremely valuable, not only for those patients that go through these types of treatments, but really for any woman. Again, I'd like to thank you for your attention. My name is Dr. Dan from Fertility. I'd also like to thank the Breast Cancer Resource Center of Santa Barbara for allowing me to speak to you today, and also like to wish you a wonderful Pink Week.